All right, welcome students. This is module 101-1, and today we will be going over a supplemental PowerPoint. This is veterinary medical terminology and abbreviations. Okay, and you will notice this is out of a different textbook. This is out of a different veterinary assisting textbook. Like I said, this is supplemental. So we will go over chapter 3, which is your chapter for this module, going over with all of the anatomy and physiology. And again, going over that next week because Mrs. Rincon will be doing that separately with her class. So just doing another kind of a general, but still in the same realm, especially with your homework and all of that. So getting into the start of the PowerPoint, we're going to go over word parts. So a large part of your homework is defining prefixes, suffixes, and root words, as well as being able to tell what is a combining vowel that we add into certain words. So what a prefix is, this is the word part that's at the beginning of a term. The suffix is the word part that's at the end of a term. So the beginning of the word is the prefix, end of the word is the suffix, and the root word is the word part that gives the term its meaning. Now know that not all words are going to have pre and suffixes. Sometimes they just have one or the other, but they're always going to have a root word because they're talking about the portion of the body or what they're doing. Now, some words will also have a combining vowel, and this is a root word and a vowel that allow certain terms to be pronounced with ease. It's really just for pronunciation purposes. So sometimes we'll see extra vowels being added in like O's, just in order to pronounce it a little bit better. So looking at some common root words, you guys can see all that the O is attached to every single word that's here. So they all do have that combining vowel. So going through like cardio, that's when we're talking about the heart. And these are more of our medical terminology. So this is all of the common words. Everybody knows, heart, uterus, intestines, kidneys, everybody knows these common words, but we are talking about the scientific, the medical terms. So again, common root words, we've got the cardio being heart, think of like cardiology, that's the study of the heart. Utero, that's when talking about the uterus when somebody is pregnant. So when our animals are pregnant and they have a fetus in utero, that's how we refer to their uterus, versus when they are not pregnant, we refer to the uterus as hystero. For example, and actually we'll go over it a little bit later, think about the spay procedure. The name to the spay procedure, it's ovariohysterectomy, hyster, uterus. Then we have enero. This is when we're talking about the intestines. Reno is the kidney. So we refer to that as like the renal system. Nephro is kidneys as well. Hepato, that's when we're talking about the liver, it's specifically blood. Ovario, ovaries. Laparo is talking about the abdomen. Think of like laparotomy, which is like an exploratory surgery. Chemo or chemo, which is chemical, and arthro for joint. Some more other common root words that we have, cutane, which is skin. So think of like subcutaneous layer. So a subcutaneous injection, sub being under, cutane, skin. So giving an injection subcutaneously under the skin. Hemo, again, getting back to that, that's blood. Naso, when we're referring to the nose, we can also use the term rhino when we're referring to the nose. Think of when we're like thinking of like rostral, kind of sounds like rhino. Colo is colon or intestine. Colon is found in the large intestine, so mostly focusing on that. Gastro, we can also use that for the stomach. Masto is a term that we'll use for the mammary glands. Recto for the rectum, urino for urine, cysto, urinary bladder. So think of cystocentesis, that's to obtain a sterile sample from a urinary bladder. So cysto, urinary bladder, centesis, to poke something into, obtain a sample from. Radio, radiation, electro, electricity, osteo, bone. OT or O can also be ear, and dento being teeth. And don't worry for Mrs. Reincon's class. I'm going to upload all of this to your modules so you guys can go back and find this lecture. And I'll also show you before we're ended today where you can find it. Now getting into common prefixes, we have such as pre, that's going to mean before, whereas in post is after. Peri is a term that we use when we're talking about around. So like pericarditis, that's fluid around the heart. Peri, around, card, that's cardioitis, inflammation, or, just fluid binding. So pericarditis is that fluid around the heart. Pre, think about like pre and post-op. So that's when we're talking about surgical procedures. So post-operative, pre-operative, when we're getting them ready for surgery versus when they are post-surgical procedure and they're recovering. We can also use the term a or an, which means to be like without or to not have. And AB can be like away from. AD would mean towards. Anti is against. Sub would be below versus super is the opposite, being above. And dis means difficult or painful. And again, so we're going to combine root words with prefixes and suffixes. We don't always have to have a prefix and a suffix. Sometimes it's either or, but sometimes it's all of them together. More of these prefixes. Hypo, that means to be below normal or decreased. Hyper is above normal or excessive. So think of hypo or hyperthyroidism. Dogs tend to be hypothyroid, which means that their thyroid is not functioning up to its needed level of function. So we usually see like a lot of weight gain and metabolism issues with those type of patients. Versus hyper, that's usually our kitty cats. Cats tend to be hyper, and this is when their thyroid is on overdrive. It's super excessive, acting above normal limits. So we'll usually see fat dogs and really, really skinny cats because your thyroid controls the entire metabolism of your body. And there's several other conditions that use the same hypo versus hyper, being below or above. We use the term endo when we're talking about within or inside. So think of like endoscopy. So that's scoping inside of an animal using our scope tool. Ecto means to look within the outside of the animal. Exo can also be outside. Poly refers to many. Olgio means to be very little. And then we have inter being between and intra within. So with intra, think of with our Bordetella vaccine, which is kennel cough, we give that most commonly intranasal. So intra within, nasal, the nasal nares. So it is an intranasal vaccine. All right, now we're going to get into the common suffixes. And once I'm done with all of these examples, I'm also going to go over actual combining words where you can see it all come together. So with our suffixes, we have osis, which is referring to a condition. Emia, when we're talking about blood. Think of like anemia when we're anemic. So there's less of those red blood cells. Ectomy is a surgical removal of. Thinking back to ovariohysterectomy, ovario, we know that that stands for the ovaries. Hyster, that's the uterus. Ectomy, the surgical removal of. So ovariohysterectomy, that is a fancy word for the spay procedure. Stomy, that's to create a new surgical opening. Pexy, that's to suture something to. Plasty is to surgically repair. So a lot of these are surgical words for different surgical procedures. So when you guys get to module 105, which is your surgical mod, we'll go into a lot of detail with a lot of these different procedures. So don't worry if this seems like a lot right now. You will memorize, repetition, get better throughout the module. And once it comes to surgery, it's going to be like a refresher from this module. So tomy, that's to cut into something surgically or to make an incision. Itis stands for inflammation. Itis also stands for infection. That was a question that I had from this morning. I had a student that wasn't sure what infection would be. So know that itis is inflammation and infection. That's kind of generalized in one. Synthesis, that's the surgical puncture too. So remember when I was talking about cystocentesis, cysto being the bladder, synthesis is that surgical puncture into. So a cystocentesis is when we obtain a sterile urine sample from our patient. So we'll actually take a sterile needle and syringe, attach the two together, and poke directly into the abdomen of our patient, right into the bladder, and be able to obtain a sterile urine sample. This is very common practice. We'll do it on them while they're wide awake. Most animals don't even feel it, and it's fairly easy to do. Now, it's better to do a cystocentesis because that's a clean, sterile urine sample versus like a free catch where we're just catching the urine as they urinate. There's a lot of potential for contamination with microbes because it's going through the prepuce or the vaginal opening, touching the outside of the skin and the fur. There's a lot of bacterial potential there for contamination of the sample. Now, megaly, that's the enlargement of something, and pathy is when we're talking about a disease. Continuing on with the suffixes, ology, that's the study of. So again, like thinking of like cardiology, the study of the heart. Graph, that's to record with an instrument versus graphy is the act of actually using the instrument to record. Gram is a record of. Scope being the instrument to look at or view. Again, endoscope, looking inside with a scope, looking down the esophagus of our patient into their stomach, or we can do it up their rectum. With horses, we can actually scope them through their nasal nares because they're much larger. Scopy, that's the act of using an instrument for viewing. Again, endoscopy or endoscope when we're talking about the procedure, endoscopy when we're actually doing it. Urea, that's to flow. Rage, that's to burst. So think of like hemorrhage, bursting amount of blood. Alysis, to break down. And therapy for treatment. And then we also have some words that kind of will add in pertaining to suffixes. Not super important that you guys focus on this too much, but just for your reference, some other suffixes that you'll see kind of thrown in to make the word either sound good or better. Again, sometimes that's the combining vowel. So let's break down some terms. So again, when we look at these terms, we want to break each word into the prefix, suffix, or that root word. So the goal is to determine each meaning and put it to a definition that makes sense. So for example, we have post-operative. So post meaning after, operate, that's procedure, if with the surgery pertaining. So that's post-operative, post-surgical procedure. Again, with cardiology, cardio, the heart, ology, the study of the heart. Gast, that's talking about the stomach. Itis, meaning inflammation or infection. So we have inflammation of the stomach when a patient has gastritis. And then again, ovariohysterectomy, we can break that up, that term. Ovariohysterectomy. Ovario is ovaries, hyster is uterus, ectomy is the surgical removal of. So that's the surgical removal of the ovaries and the uterus. So when we're looking at these words together, they might look like big, really big, scary words, but once you break it down, it actually tells you within the word exactly what it's talking about if you know the correct terminology. And again, this is something that you will pick up over time. Don't freak out. I know it's a lot to take in, and it's going to be a repetitious type of a thing. The more you hear it, the more you talk about it, the more you are going to remember it, and it's going to become second nature. All right, so now we're going to go into some of the common directional terms. So I'm going to be going over other terminologies and abbreviations, and I am going to, when we get into more of our abbreviations, I am going to be asking you guys to participate and share within the chat box what those answers are. So when we're talking about our directional terms, know that we don't use right or left or up or down. I know you guys just watched a video on this. We use certain directional terms, and this is also directional terms that they use in human medicine. Same with all the prefix, suffix, root words, you guys, that's all used in human medicine. We are all one medical field. Even though we work with animals and they work with people, our medical terminology is the same. So when I'm talking about the lateral aspect of the body, I'm talking about the side of the body that's towards the outside aspect. Versus when I'm talking about the medial side, that's going towards the midline, towards the inside of the body. Distal, that means to go away from the center of the body, and that's actually specifically talking about the legs. So when you see the term distal, that means to go down the leg towards the paw. So not going up the leg, going down away from the center of the body, down the paws, down the legs. Dorsal is talking about towards the back of the body, so the spinal area. So their back would be their dorsal aspect. Cranial sounds like cranium. It means to go towards the head of the body. When we're talking about palmar, that's referring to the bottom of the front feet. And rostral, when we are specifically looking at the head, we don't use the term cranial anymore because we're already at the head. We'll use the term rostral instead, which means to go towards the nose. And then the flip word for that would be caudal, which is this down here towards the tail of the body. So it's either cranial going towards the head or caudal. Versus when we're talking about just the head, we'll use the term rostral, which is towards the nose, or caudal towards the tail. Now again, with that medial, which means towards the inside. So lateral means to go to the outside of the body. Medial means to come towards the midline, towards the center of the body. So think about the veins that you use, like our saphenous veins when we're pulling blood. On our cats, we use the medial saphenous vein. That is the inside vein on the back leg. Versus dogs, we use the lateral saphenous vein. So that's the back leg vein that's running on the outside of the leg. Looking at proximal, this is the term that we use when we're talking about going towards the center of the body, but specifically when we're looking at the limbs, at the legs. So again, distal is going towards the paw. Proximal would be going up the leg towards the belly. So distal towards the paw, proximal up the leg towards the shoulder or the hip, depending on what leg you're talking about. But those terms are specific to the legs. Ventral means to go towards the abdomen. So the ventral would be the abdomen, the belly, versus dorsal is when we're referring to their back. So each term has a flip side. Again, it's not going to be up or down or right or left. We're going to have these terms that kind of take place of that. Plantar, that's going to be the bottom of the back feet. So palmar is the bottom of the front feet. So think of like their paw pads. And plantar is their back feet. When we're referring to an aspect, that's just a certain area. And then when we're talking about recumbent or recumbency, that's how that animal is laying down. So you guys, if I have my patient in lateral recumbency, what does that mean? How are they going to be laying down? You can type it in the chat or say it. Oh, sorry. Ooh. Just trying to pull up my chat window here. So what does it mean to be in lateral recumbency, you guys? What is lateral recumbency? We were just talking about this. Awesome. I'm seeing some great answers. So yes, that is on their side. When they're in lateral recumbency, they are laying down on their side. Now, when we have them in lateral recumbency, if their left side is down on the table and their right side is facing up, are they in right or left lateral recumbency? If their left side is on the table and their right side is facing up, is this left or right lateral recumbency? And I want to see what you guys think. So please type it in the chat box, you guys. I want to see everyone participating. And it's okay if you're not sure, because I'm going to tell you the answer. All right, so I'm seeing a majority of the right answer in there. I'm kind of split. So the right answer would be when the patient is laying on its side and it has the left side down and the right side in the air, they are in left lateral recumbency. So we will label it by what side is on the table. So if they're laying on their left side, it's left lateral. If they're laying with their right side down, it's right lateral. So know that, and that's really important when you get to your radiology, your x-ray module, because we're going to talk about x-ray positionings, and we have to label our patient depending on what side's on the table, because their organs stack on each other differently depending on which way they're laying down. So really, really important, whatever side is on the table, that's whatever lateral recumbency that they're in. Now, when we're talking about transverse, this is talking about like the planes of the body, which is an area that will divide into cranial and caudal sections. And I want to show you guys next a picture here. So kind of a diagram of those directional terms. So A here, which is going towards the head, that is our cranial, versus the flip side of that, going towards the tail is caudal. So cranial towards the head, caudal is towards the tail. C is ventral, which is going towards the belly. So we have C towards the belly. Now the flip side of that is going up and towards the back, and that is dorsal. So it's either ventral or dorsal. Then when we're specifically talking about the head, remember we can't be cranial anymore because we're already specifically on the cranium. That's the skull. So we're going to use the term rostral towards the nose, and then we'll still use the term caudal towards the tail. Then looking at this term F, that is moving up the leg over here, you guys. So going up the leg towards the shoulder, that's going to mean proximal. Or if you were back here on the back leg going up towards the hip, that is also proximal. It's just talking about the limbs. The example here just shows the front. Then with G, that's distal. So that's going down towards the paw, towards the toes, you guys. So proximal is going up the leg. Distal is going down the leg towards the paw. Now, then when we're talking about the back aspect or the caudal aspect of the legs, for the front leg, the caudal aspect, which would be like the paw pad, kind of this back aspect, is palmar, versus for the back legs, that caudal aspect is plantar. Okay. Now I'm going to get into some species terms. So we all know common names for animals: dog, cat, horse, cow, but we have scientific animal kingdom names for them, such as canine, feline, equine, bovine. So these are their scientific names, and you are expected to know these as veterinary assistants. Now, mainly, you guys are going to be working with canines and felines, which is our dogs and cats. But there might be a few of you that go into larger animals, exotic animals, pocket pets. So I'm going to go over all of the species terms, and then I'll go into the sex terms, because we do have different terms for, let's say, a female dog versus a male dog, or a female cat versus a male cat. We don't just say female or male. We actually do have specific terms for all of that. So again, our canine, that is our dog. Feline is our cat. Equine is horse. Can you guys see the pattern there with pronunciation? Bovine is our cows. KV is the term that we use for guinea pigs, as well as like just pocket pets in general. We'll even throw what's the other one? Ferrets will also be considered to be KV. Primates, that is our monkeys and apes. Poultry is considered to be chickens and turkeys. Ducks also fall under that poultry. Murine is rats or mice. Ovine is our sheep. Porcine is our pigs. Caprine is our goats. Lagomorph is a rabbit. That's a fun one. Avian, those are our wild birds and domesticated birds, but not our poultry, like our livestock, like chickens, turkeys, and ducks. So that's separate from our avians. Reptiles, that's going to be our snakes and lizards, versus amphibians will be more directed towards our frogs and toads. Then we have terrapins, which are considered to be turtles. So now I'm going to get into the animal just the common animal terms. And again, I'll be going over the different sexes, as well as what we would call them when they're adolescents or in infancy, and the birthing process as well. So when we're looking at our dogs, again, this is our canines. And when we are looking at our intact canines, or just intact animals in general, when we say the word intact, that means that they are capable of reproduction. So they still have their reproductive organs. So if I say an intact male dog, I'm talking about a dog that still has their testicles, or an intact female dog, they still have their ovaries and their uterus, they can still reproduce. So we do have other names for them. So we will call our female adult dogs, they are known to be as a bitch. I don't know if you guys have ever joked around about that or heard that, but that is the actual term that we use for our female dogs. Then stud dog, that's going to be our male adult intact dog. Puppy, those are our newborn dogs. Now, when we have a whole group of newborn dogs, that's considered to be a litter. And we don't say that the bitch is giving birth, we will say that the bitch is whelping. So that is the labor process for dogs. So we do have some different terminology there. And that goes for almost every single breed of animal. All right, let's get into our cats. So we know that our queens, those are the adult female cats. Toms are known as our adult male cats. And kittens are our newborns. Now, when the queens are giving birth, it's called queening. That's their labor process. And same as dogs, when they have a group of newborn kittens, that is a litter. All right, we're going to touch on our rabbits, and we know our rabbits are the lagomorphs. I love that. So our buck, that's the adult male intact rabbit, versus Lapin is the neutered male rabbit. So it's actually pretty common to neuter rabbits, just because you can't have intact males together in the same cage. They will kill each other for dominance. So if you intend to have male rabbits together, they have to be neutered. So again, the buck is the intact male rabbit, versus the Lapin is the one that is neutered. Then our females, regardless if they're intact or not, are the does. When we have newborn rabbits, we call them kits. And the labor process of rabbits is kindling. So the doe is kindling, the doe is giving birth. All right, then we have our ferrets and guinea pigs. Again, this is our cavy. So a Jill is considered to be the female ferrets. A hob is an intact male ferret. A sprite is a neutered female ferret or a spayed female ferret. And a gib is a neutered male ferret. Then with our guinea pigs, they're actually really similar to our porcine or to our actual pigs with the terminology here. So sow would be a female guinea pig, while the boar is a male intact guinea pig, and a pup is a young newborn guinea pig. Then we have our rats and mice. So the dam would be an adult female intact rat or mouse. And this can be intact or not intact. We just say dam for female. While the sire, that is the adult male for the rat or mouse. And a pup is the young newborn for the rat or mouse. Then getting into our poultry and birds. So that's our avian friends and the poultry, which is considered to be with our ducks, chickens, and turkeys. So a cock or a rooster is the term that we're going to use for an adult intact male chicken or parrot. Now, we commonly know the term rooster, but that's really only when we're talking about chickens. When we're talking about avians, so just birds in general, we usually use the term cock for the adult males that are intact. Hen is what we're going to call the adult female chickens or parrots. And a cockerel is an immature male chicken, which means that they're usually under 1 year of age. A pullet, that's an immature female chicken. And a chick is the newborns for the chickens. Then we have poults, which are young chickens or turkeys. So usually like within like the first 3 months of age. Flock would be a group of birds. So when we have them all grouped together, it's one big flock. Drake is the term that we'll use for male ducks, while a duck is just the term that we use for female ducks. And ducklings are newborn ducks. Then we'll get into our pigs. Again, pigs are known as porcine. We have our sow, which is an adult female intact pig. The boar, which is the adult male intact pig. Again, similar to those guinea pigs. The barrow, which is a young castrated male pig. And we use the term castration when we're talking about large animals. So neutering and castration are the same procedure. It is the surgical removal of the testicles. But in small animal, we use the term neuter when we're talking about large animals, so horses, livestock, which pigs are a part of livestock, we are using the term castrated. And that's just differentiation there. So if you don't work in large animal, you're not going to see the term very much, but just know that it's the same thing as a neuter, it's just for our larger. Then we have the stag, and that's an adult male castrated pig. So barrow being young, stag being older. Gilt is going to be the young, immature female pig that is not farrowed. And farrowed means, or farrowing is the labor process of pigs. So a gilt is a female pig that has not had a litter yet. And piglets are our newborn pigs. With our horses, also known as equines, we have stallions, which is our adult male intact horse. Mares are the adult female horse, whether they are intact or not. We call them, it's just a general term, we call them mares. Now, then we have our younger horses when they're in young age, usually within under a year of age, or even 6 months, kind of up to a year. We'll call them colts or fillies. So a colt is a young male horse, while a filly is a young female horse. But when we have newborn horses, regardless of the gender, we will call them foals. Now, when we castrate the male horses, which is very, very common, you cannot have stallions with other stallions. They will kill each other. They are asserting their dominance, trying to become alpha. You cannot have more than one stallion per herd. And usually you're not going to place the stallions with the females unless you want them to breed. So for the most part, if you have a male horse, it's usually going to be gelded. And you can have geldings all together in one big group. They don't care once those testicles are gone, all that testosterone and that asserting and wanting dominance, all of that goes out the window. Geldings are super, super friendly and great with each other. So again, don't really see very many stallions. And if we do, they're isolated versus geldings. When we castrate them, we can have them all together. Our weanling, that's the term that we're going to use for a young horse under a year of age. Versus yearling, that's when we're referring to a horse that's between 1 and 2 years of age. So they're in their 1-year-old year, yearling. And then when we're talking about a whole group of horses, that's a herd. So the herd of horses. Getting into some other facts about equines, when we are measuring their height, we measure equines' height in hands. So when I'm talking about equines, I'm talking about horses, donkeys, as well as mules and jinnies. So that's all together in that equine. So horses are generally 14.2 hands in height. So again, we don't measure them in regular like centimeters or inches, we measure them in hands. And if you think about it, looking at like my hand is about 4 inches long. And so that's actually the measurement for our hands for the horses. So again, a hand is a measurement that equals 4 inches. So a horse is about equal to 14.2 hands and over in height, whereas in our ponies are going to be 14.2 hands and under in height. So it's not necessarily a breed differentiation. Yes, we have pony specific breeds, but we can have really small horses that are actually pony sized. Again, continuing on with our equine terms, donkeys and mules and hinnies are also considered to be equines. So our donkey, a donkey is a donkey crossed with a donkey. Donkeys are its own animal, just like how horses are. But you guys may have heard of, more commonly people know mules. And a mule is a cross between a male donkey and a female horse. So they're pretty much the size of a horse, but they have really big, long ears, just like a donkey. And mules are incredibly strong animals. We use them as pack animals. We used to use them on the railways back when they were building those. They are just hardy animals, scale up the side of a mountain. Mules are incredible as like a hybrid cross between a horse and a donkey. Now, what you might not have known is they're not all called mules. We can also cross a male horse with a female donkey, and that's where we get a hinny. Now, we don't see very many hinnies like at all. And the reason for that is because donkeys are significantly smaller than horses for the most part. And we don't want to be breeding a large horse with a small female, because then we risk the fetus being too large, possibly fracturing or breaking the pelvis of that equine when they're trying to give birth. So for the most part, we don't see hinnies very often at all, unless the male horse is a donkey or very small or similar in size to that female donkey. Donkeys are also pregnant for 12 months. So they are pregnant for a lot longer than horses. So it's more preferred to breed a female horse, and their gestation, they're only pregnant for 9 months, same as humans. So we usually see the mules. Again, that's the cross of the male donkey and female horse. So because the male is smaller than the female, we know that the fetus is not going to outgrow the female. They're going to be safe when they are foaling or giving birth. When we're looking at our donkeys specifically, we do have terms for our donkeys. We say Jack, that is our male donkeys, and Jennies are our female donkeys. Now, one more fact about hinnies and mules: because they are a cross between a horse and a donkey, they are born sterile. So mules and hinnies cannot reproduce because they're like a hybrid mix between the two. They're born sterile. All right, and this is going to be the last slide that I have before our break. So we have our sheep and our goats. So that is our caprines. And we have ewes. Those are female sheep, adult female sheep. Rams are the adult male sheep. When we're talking about our newborn sheep, those are our lambs. And lambing is that labor process for the sheep. Now, when we're talking about goats and cows as well, we do have meat goats, so goats that are bred for their meat, and dairy goats, goats that are bred, or cows that are bred for their dairy. So they're completely different breeds. And I believe it's module 103 when you guys will be focusing on memorizing 103 or 104 when they go over all of the breeds, which is very, very interesting. So know that we do have both different kinds. So freshening, that's a term for the labor process of dairy animals. Buck, that is our male goat. Doe is the female goat. Wether is going to be a castrated male goat or sheep. And again, castrated, that's just the large animal term for neuter, so the removal of the testicles. Kid is a newborn goat, and kidding is that labor process of the goats. All right, so we'll get back where we left off in the lecture. Okay, so going to the next topic here, we have our common animal terms for our cattle and our llamas. Now, cattle, that is our bovine. Llamas are known as camelids. So they're kind of part of the camellia. So like your camels, llamas, alpacas, they're all in the same family. And Abigail, that's completely fine. Thank you for letting me know. So with our terminology for them, for our male cow or llama, we call them bulls. Cows are female cow or llamas. We refer to heifers as those are young female cows that have not been bred. So they haven't had any calves yet. And those are usually the young females. Stag, that is the mature castrated male cow. Versus steer, that's the young castrated male cow. And again, castrated, that's just the large animal term for neutering. Calves, those are our newborn cows, and calving is the labor process of cows and llamas. But we call young llamas crias. All right, and we're gonna go over kind of like some flashcards. And I highly recommend that you guys make flashcards for these terms. It's going to help a lot when memorizing them. So I highly recommend it because we did go over a ton of terms and we're going to keep going over more. So as we get into more of these are going to now be abbreviations. So we just went over a lot of medical terminology. Now we're going to get into abbreviations that we're going to use for exams, for medical charting, throughout the clinic, just for everything. So again, I highly recommend that you guys make flashcards. It really will help you. It was something that really helped me a lot when I was in school and just in the field. And it can help make terminology just be a little bit more fun. You don't have to study for that long, like 5 to 10 minutes every day. And you will be surprised how much repetition and constant studying will help you. Okay, so we're going to get into some abbreviations here, and I'm going to want you guys to use the chat box for this. Thank you for everybody that was messaging me about the camera. I appreciate it. I see your message. So what I'm going to do is I'm going to ask you guys, okay, what does YR stand for? And I want you guys to type in the chat what you think YR stands for. Then I'm going to tell you, once I see a few answers in there, I'm going to tell you guys what it actually means. And we'll go through that with all of these for a few pages. So guys, what does YR stand for? And it's okay if you get it wrong. Don't worry, you guys. This is all review and to help you guys learn. So if we're doing the physical exam, what do we think YR would stand for when we're talking about our patient? Yeah, YR is the abbreviation for year. So we're talking about the patient's age. Absolutely. What about SF? When you see SF in the patient chart, this is talking about a female. Yep, so SF. Absolutely, yep. So SF is our spayed female. So we can abbreviate that. What about DLH? This is when we're talking about cats, specifically cats that aren't like purebred. So we'll use this abbreviation for a lot of our Lilo, come here. My cat like wants to jump up, but she's nervous. Yes, good job, you guys. So that is our domestic long hairs. So we have domestic short hairs, so short-haired cats, domestic medium-haired cats, and domestic long hairs, which are the long-haired cats. And again, those are cats that are not purebred, kind of like any type of a mixed breed that doesn't, that could be a whole mixture. All right. Then PE. What is PE? Yes, that's our physical exam. So when we are examining our patient. What about V and D? And I might see a few different answers on these. V and D has to do with directional terms. Because I saw a lot of answers that were not correct this morning. So it has to do with directional. Yes, good job, you guys. So when we're talking about V and D, we're talking about ventrodorsal. And I'll actually type it for you guys in the chat so that you can see how I would spell this. This is ventro. So ventrodorsal. So we're talking about ventrodorsal when we're putting them into a X-ray position. So ventrodorsal, dorsal, we know that means on their back. Ventro means their belly. So dorsal or ventrodorsal means to go from the stomach. The beam is going to hit the stomach first to the spine. So they're going to be laying on their back. The beam is going to go from the ventral aspect to the dorsal aspect. That's how it's going to take the picture. Now, you might also see V and D stand for vomiting and diarrhea, but a lot of the time it will be like just V or D separately because VD is known as that directional term. What about WNL? If I'm talking about a patient and they're nice and healthy, I would say the patient's vitals are WNL. And if you guys don't know these terms, it's completely okay. I know I have a lot of new students that are here. So if you don't know these terms, just write them down. Take some notes on them, make some flashcards. Again, you guys are in a beginner module and we'll be using these terms throughout the entire course. And when you get into your externship and into the field, you guys are expected to know these. So don't get too freaked out. Take your time, make the flashcards, review. It's going to become second nature. So again, WNL, good job, you guys. That is within normal limits. So again, if I took like my patient's TPR, what is TPR? Yeah, temperature, pulse, respiration. If I'm taking my patient's TPR and it's all normal, I would say that the TPR is WNL. The TPR is within normal limits. Now, guys, what is also another abbreviation that we can use for pulse? The pulse is measuring what? What is it measuring? The heart does what? What is it measuring? What is pulse? What's another word for pulse? Not the beat, although it is counting beats. But what would be the other abbreviation when I'm talking about the pulse? It starts with heart. H what? Don't overthink it, you guys. So when we're talking about the pulse, we are talking about the heart rate. Good job, Aislinn and Madison. Good job. So the pulse is also known as the heart rate or HR. Same with respiration, that's breathing. So we can also use RR as respiration rate. So you might see HR, heart rate, and RR, respiration rate, rather than P and R. All right, what about WT? Yeah, our patient's weight, good job. And we know LBS or the pound sign means our patient's weight in pounds, absolutely. What about CBC? This is talking about some laboratory work. So when we're performing lab work on our patients, a CBC is a common panel that we're going to do for our patients. Right on, I see some right answers in the chat. So it is a complete blood count. So guys, if we're counting the blood, what do you think we're counting? What is it that we're counting? What am I counting when I'm looking at complete blood count? Red blood cells, what else? So I have red blood cells, what else would I be counting? We have red, and what's the other? White, yes. So red blood cells, white blood cells, that's also known as erythrocytes and leukocytes. Now I'm also going to look at my platelets, which has to do directly with the clotting factors. And our CBC will give us our total protein, which has to do with our plasma. Good job, you guys. Now, we know in this next term, RADs can also be known as X-rays. Now, the fancier term for all of that would be radiograph. I want to go take a radiograph, which is an X-ray. What about DZ? What do we think DZ means? DZ. The patient has a DZ. It's a condition. They have a DZ. Something's going on with this patient. Very good. DZ stands for disease. Very good, you guys. Very good. All right, what about DX? Very good. Good job, Annie. Good job, Ariana. That is diagnosis. Right on. What about TX? I want you to take the patient to the TX room, the treatment room, which is usually the big room in the back of the veterinary clinic that is going to have a one or a few exam tables, maybe x-rays back there. There's hospitalized patients. So that's the treatment room. What about BX? We need to take a BX on this patient. We need to perform a BX. There's a mass. Yeah. So we'll perform a biopsy, and this can either be a punch biopsy. We could be removing the mass altogether, or doing a fine needle aspirate, which is when we're taking a needle and we're poking into the mass, and then we're squeezing that out onto a slide to look at it that way. So that's a biopsy, trying to determine if it's cancerous or not. What about O? We're referring to O. So there's a P and there's an O. Who is the O? Yeah. O is owner. So I would say O is bringing P in at 3:30 p.m. Owner is going to bring patient in at 3:30 p.m. And we know tabs, that's just an abbreviated word for tablet. I expect you guys to know that. What is PO? Give the medication PO. Yes, orally or by mouth. What about SID? We're talking about medication frequencies. Perfect. So I'm seeing once a day, but how many hours? I want you guys to get into the habit of knowing how many hours are in between doses. Yep. So once a day is also every 24 hours. And I'm going to tell you guys an example of why that's so important. So I've seen this happen probably a handful of times, unfortunately, where the owner misunderstands what the dose really means. So once daily, you guys, that could mean that that owner is thinking, oh, perfect, I'll give the medication tonight. When I get home from the appointment, I'll give it tonight. And then I have a really long day tomorrow, so I'm not going to see the patient till way later. So I'm just going to do it tomorrow morning, because that is technically once a day. That was once in the PM and once in the AM the next day. But that turned into about 12 hours between the doses. If this is a narcotic or an opioid, they are overdosing and can kill their patient. Guys, I have seen animals rushed into the ER that are lateral, not responsive. We have to give them Narcan. We use the same drug when we're trying to reverse the effects of opioids in animals as well. And I've seen this happen a lot because the owner doesn't understand that once a day means every 24 hours. And I know that it seems like common sense, but common sense is out the door. We have to treat them like they don't know, because in reality, not everyone does. So when I write a prescription label, I would say, let's say the order is to give 1 tablet PO SID until gone. I would say give 1 tablet by mouth once daily, in parentheses, every 24 hours until gone. So I would say the frequency, once, twice, 3 times daily, whatever it is. And then I would tell them the hours. In parentheses, I would give them the hours, so that covers all bases, making sure that they know the frequency as well as those hours, so that dose doesn't get confused or messed up, because overdoses do happen, and a lot of the time it is an accident. All right, what is BM? The patient just had a BM. Bowel movement. Yeah, what does that mean? What's a bowel movement? Yeah, bowel movements poop. But we're not going to say that in the chart. We're going to say that they had a BM. Good job. All right. Okay, now we're going to flip it around, and I'm going to give you the definition of these terms, and I want you guys to give me the abbreviation. So I have twice a day. Give a medication twice a day. Yeah, that's BID. Absolutely. And how many hours if it's twice a day? How many hours in between doses? Every 12 hours. So give this medication twice daily, in parentheses, every 12 hours. Again, that can also get mixed up where owners think, oh, I can give it in the morning and at lunchtime because that's still twice a day. No, you're absolutely giving it way too soon. Okay, what is by mouth again? We just talked about that. What's the abbreviation? Yeah, PO is by mouth. What about surgery? What's our abbreviation for surgery? Yeah, that's going to be SX. And prescription? Think about it, you guys. You get an RX from your doctor. Prescription is RX. So it's the same with people as it is with animals. RX. Yeah, good job. Now we need to give this medication 4 times a day. That is QID. How many hours? That's correct. Every 6 hours. Yep. QID means every 6 hours. That's 4 times a day. What about history? What's my abbreviation for history? Yeah, that's going to be HX. Good job. What about diagnosis? Yeah, DX. Perfect. What about the gums? I'm referring to the gums. I'm going to be checking their color and their moisture level. What's going to be my abbreviation when I'm checking the gum color and moisture? Yeah, that's going to be MM. Guys, what does MM stand for? What's MM? Mucous membranes. So that is the gums. So when we're doing our mucous membranes for our patients, we are checking the gum color. So is it pink? Is it red? Is it gray? Is it blue? What is the color of our gums here? It could also be yellow. It could be ictric. Then we're also checking for the moisture level. Is it nice and moist? Is it tacky, which means is it sticky on your fingers? Or is it dry, bone dry, really dry, which would mean that our patient is very dehydrated. What about treatment? Yeah, good job, everybody. TX. Again, with pulse, what's pulse going to be? There's 2 abbreviations. You can use P or what? Not RR, because that's respiratory rate, HR, heart rate. So pulse is P or HR, heart rate, same thing. All good, all good. Know that RR is respiratory rate, so that's breathing. Perfect. Okay, and then biopsy. Yeah, good job, guys. I see you guys are already getting right on it. Good job. So biopsy is BX. What if something is positive? Let's say this fecal test that we just ran was positive on our patient. So they were positive for worms. We could definitely put POS, but is there a symbol that we can use? Yeah, the plus symbol. So we primarily will use that plus symbol as positive, but I've also seen POS as well. But usually it's the plus sign, positive. What about every? Give the medication every 8 hours. What would be the what's the abbreviation for that? Every. Give the medication every 8 hours. What would every be? Yeah, so it's going to be Q. So every is Q. So if I said give the medication Q8 or Q8H would be Q8 hours, every 8 hours. So Q is every. And then we already know this, pounds is going to be the LBS or the pound symbol. What about right ear? What's my abbreviation for the patient's right ear? Their right ear. Is it going to be AS? Would the right ear be S? That's correct, Yvonne and Aislinn. That is AD. AD is the right ear. AS is the left ear. And AU means both ears. So I'm going to give you guys a little trick in order to memorize these. So think about it with ears. Think about German Shepherds. They have A stand looking ears. They look like A's, their ears. So know that ears are A's. Now, I also want you to think about, draw the letter S in the air. And which way does your finger end up going? Draw the letter S, and which way does it go? It ends up going to the left. So AS is the left ear. Now draw a lowercase d, and where does your hand end up? It goes to the right. AD is your right ear. Now, when you draw a U, it touches both ears, so AU would be both ears. Now, that's just something that I kind of compiled when I was in school that really helped me. I was a teacher. She actually did a cute little cheer. She was like, what she did, she was like, it's A, S, and then she did A, D, and then AU. And I just thought it was the cutest thing. I loved it. It really helped me memorize it. So, and I also use that for the eyes. So the eyes, the abbreviation for eye is O. Think of round O like an eyeball. Now put it together. What is left eye? Yes, good job. The left eye is OS. So same thing. Right eye would be OD, and both eyes would be OU. All right, so now we're just going to get into some more patient information. So a few more abbreviations, kind of going over the answers of what we've done before, and adding a few more terms in there as well. So when we're talking about canines or dogs, we can actually write canine out as the letter K and 9. Again, when we're talking about our kitty cats that are not purebred, we usually we'll categorize them as domestic short hairs, domestic medium hairs, or domestic long hairs. When we have intact male or females, we'll just call them male or female. But if they're spayed or neutered, that becomes spayed female SF or neutered male NM. So the sex would be SF, NM, M, or F, depending on what their status is. Now, if it's a large animal, we could say C or cast for castrated for the males. It's not very common that we will spay large animal females. It's really, really uncommon because it's a really risky procedure. Okay, getting into patient information. We know O stands for owner. Y or YR is our year. And this is talking about like the patient's age. Month, we could put how many months old they are, MO, or even if they're only a few weeks old, WK, especially when we're looking at like vaccines. When we're starting them on their puppy or kitten series, we started at 8 weeks, then 12 weeks, 16 weeks, 20 weeks. So we'll talk about weeks versus, I mean, you could say, you know, you started at 2 months, 3 months, 4 months, 5 months, but we'll use that a lot. And then D would be day. When we're dealing with exotic patients, we would use the abbreviation EX. We can also use the abbreviation AV when we're dealing with avian exotics, so our exotic birds. CSECT is the abbreviation for a cesarean section. So that is when that's the removal of the fetuses from the mother under anesthesia. So if they cannot birth them naturally, we will put them under anesthesia and we will surgically remove them. That is a cesarean section or a C-section. Then we have some other abbreviations that we use commonly in the vet field, especially when we are scheduling appointments, drop-offs, pickups, discharge. So I would say like P is to be DO at 3 p.m. Patient is to be dropped off at 3 p.m. Or P's pickup time or P's PU is at 3 p.m. Patient's pickup time, 3 p.m. Discharge or DC, we will discharge our surgical patients, hospitalized patients, any patients that have a lot of instructions to go home is a discharge. It's not just a pickup, which that's like, you know, they're just picking up and paying and leaving, which could be like a wellness appointment or something. If they were hospitalized or they had a surgery, it's not a pickup, it's a discharge because a nurse actually has to go with that owner and explain them all of the discharge instructions. REC would be a recommendation. SR is suture removal. So that's when we're removing the sutures from the incision that were placed by the veterinarian post-surgery. SX we know is surgery. Now, you guys, how long after we do a procedure on a patient, so how long after surgery are we going to remove the sutures? When do we remove sutures from our patient after the surgery? How long? How long after do we have to wait? Give me your best guess. So how long do I wait to remove sutures? I want to see a few more answers in there before I let you guys know. Okay, I'm seeing like a week, 10 days. Awesome. So I'm actually going to tell you a range. We usually recommend that owners come back to do the suture removal anywhere from 10 to 14 days post-op procedure. We give them a little bit of a range because scheduling, sometimes we can't always exactly do 2 weeks. But traditionally it's 10 to 14 days. Now, sometimes the patients will come in and their sutures are not, it's just like not healed up yet, the incision. So we'll actually keep the sutures in for a little bit longer. We'll tell them just come back in 5 days or a week and we'll remove them then. So sometimes it does get pushed out more towards 3 weeks, but standard is 10 to 14 days. And that goes the same with sutures or staples, that's the same for both. All right, when we're looking at our patient history, HX stands for history. V is vomiting, D is diarrhea. See how they're singular, they're not together as BD. PD stands for polydipsia, and that is increased thirst for our patients. So they're drinking excessively. Now, along with polydipsia, we usually see what's called polyuria, which is increased urination, which reasonably so. If they're drinking more, they're going to be urinating more. U would be an abbreviation just when we're talking about urine. And then CS stands for culture and sensitivity. Now, we will run a culture and sensitivity laboratory test on a urine sample, especially when, it's a UTI we've been trying to treat. Maybe it's becoming antibiotic resistant and it's just not working. The antibiotics we're trying to use, it's not working, it's getting worse, or it's reoccurring. We will run a CS, a culture and sensitivity on the urine, and the laboratory specialist will tell us what is the correct antibiotic we need to use, what is it resistant to, what is it going to work with, and then we can adequately treat that patient, especially if it's been reoccurring and we just can't get rid of it. Now, actually, before I move on, I do want to go over what would be a main reason to cause antibiotic resistance. You guys have probably heard of that term before, antibiotic resistance. What is the most common way that happens? That's when the body stops reacting to the antibiotic because it's become familiar to it. What causes antibiotic resistance? Think about if you were ever prescribed an antibiotic. What is one of the most important instructions when you take an antibiotic?
To finish the medication.
To finish the medication. Who said that? Good job. So you have to finish all medication of the antibiotics. If you stop the antibiotics early, you're not going to clear out the entire infection. Usually owners will see that the patient got let's say it's a 2-week course of antibiotics and they're like, well, the patient was better after a week, so I stopped giving it. Well, guess what? It only got better because the antibiotics started working, but it didn't clear out the infection. So they stopped giving it halfway through. Then all of that bacteria grew back, and now it's resistant to that antibiotic because it's familiar with it now. It knows how to not be affected by it. It will mutate, it will change, it becomes more aggressive. So we see antibiotic resistance a lot. So when we prescribe antibiotics, and this goes for yourselves too, you guys, humans have massive problems with antibiotic resistance. We also take way too many antibiotics, and we do that in animal, veterinary culture as well. So know that when we prescribe those out, we have special stickers. We'll put it in the instructions. Must give all of the medication. Do not stop early. All right, getting into some more terms here. BM is bowel movement. Anorexia is not eating, which patients can become anorexic for a number of reasons. This could be like post-op procedure. They're not feeling well. They're coming off of those anesthetic drugs. They might really not want to eat, or if they were through a traumatic event, let's say like hit by car, which is also HBC, which is our abbreviation over here. They definitely are not going to want to be eating. That's when we would have to place like a feeding tube in our patient when they become anorexic. And we do have appetite stimulants, but they don't always work. Lethargic is a term that we use when, tired, yes, but this is when our patient is listless. They don't want to move. They don't want to do anything. They're curled up in a corner. They don't even want to look at you. That is being lethargic, suffering from lethargy. DZ, that's when we've got a disease going on. Dysuria is the term that we use for trouble urinating. Hematuria is also a term that we use when there's blood in the urine. And HBC, like I said before, is hit by car. So if your receptionist runs back and says, we got a patient, ETA is 10 minutes, they were HBC, that's an emergency we're setting up right now. We're going to be waiting for this patient to come in because we don't know the type of condition that they're in. HBC is one of the most traumatic injuries you can ever seen done to a patient. And unless you work in emergency, you probably won't be seeing cases like that. But no, when you hear HBC, that's very, very serious. Getting into some more of these abbreviations, PE, that's our physical exam. BAR is bright, alert, and responsive. QAR is quiet, alert, and responsive. We know TPR, temp, pulse, respiration, and respiration, that's our breathing. Pulse is the heart rate. N, or the negative symbol, will suggest a negative result. We usually use the negative or, the plus or minus signs when talking about positive and negative. That's pretty common, but we can also use the POS for positive or N for negative, but it's more common to see the symbols used instead. We know mucous membranes are our gums. So the color and the moisture, which is MM. Then with mucous membranes, we're usually going to be taking a CRT, which is a capillary refill time. So when we look at the gums, we're going to press on the gums and then release the pressure. When you press on the gums, they'll become white. When you release the pressure, you're going to count how many seconds it takes from the gums to be that white color to turn back to that normal pink or whatever color they were prior to you applying pressure. So normally the capillary refill time should be a second or 2 seconds, but if they're really dehydrated, it could be upwards of 3 or 4, and that's going to be a determination of that. And then VD, like we said before, that's ventrodorsal, talking about our patients being on our back for an x-ray. Continuing on with the physical exam notes. So HR, we know that that's also our heart rate. So pulse is also HR, heart rate. Same with R, that's also respiratory rate, or RR. ABD is the abbreviation for the abdomen. LN is when we're talking about the lymph nodes, and they have several lymph nodes all throughout their body. WT is the patient's weight. Acute is when we're talking about how fast a condition occurs. So an acute onset would be a very fast onset. So the condition occurs in a really short amount of time. So that could be, for example, FELV in cats. Feline leukemia is a very acute condition where it is cancer and they have a very poor prognosis. Most cats will die within a year of being diagnosed. It's very, very acute. Versus chronic, that's going to be a condition that occurs over a long amount of time. So another example would be kidney failure cats. It's very common in older kitty cats to get kidney failure. And when that happens, it's chronic. So cats can live with kidney failure I've seen cats live for 5-6 years with kidney failure, as long as we're treating them correctly for it and giving them their medications and fluid therapy. It is a chronic condition. Same with congestive heart failure. As long as the dogs are on medication for that, they can live for quite a few more years. It's a chronic condition. DX, that's our diagnosis. PX is prognosis. So prognosis, that's the likelihood of survival. So that could be, with FELV, it's a very poor prognosis. I don't even know if it has any success rate on survival of FELV. So very poor versus very great prognosis for something like, for like for the kidney failure, you could say that, it's got a 75% survival rate when we treat it accordingly. So it's actually got a very positive prognosis, although it's a chronic condition. TX is treatment, and URI is talking about upper respiratory infections, which are really common in cats, especially feral cats or shelter kitty cats. This is related to FVRCP, which is their one of the core feline vaccines that we vaccinate them for. Feline viral rhinotracheitis is a URI, which is upper respiratory infection. Continuing with some of those physical exam abbreviations, UTI is the abbreviation we use for a urinary tract infection. We have our SOAP, which we'll be doing for every single patient that walks through the door that gets an exam. We will be filling out a SOAP. That is the exam notes. So SOAP stands for subjective, objective, assessment, and plan. And as an assistant, you will be dealing with the subjective and objective. So subjective, that's why are they here? Why is the patient in today? What's going on with that patient? The history. Versus objective is going to be like your vitals, any other details, physical notes that you see, physically can see it with the patient, or vitals that you took. Now the doctor will deal with the assessment and the plan. The assessment, that's the physical exam that they'll do. So all of the notes from the physical exam, and then the plan is the plan moving forward, what they want to do with this patient. Anals or AG, that's going to be the anal glands. And we do commonly express anal glands on patients, especially our small dogs. Small dogs tend to have anal gland issues where they don't express them naturally. So we actually have to go and squeeze them and manually express them for them. So a lot of people will misconstrue when dogs start to scoot on the ground. A lot of the time, that's not worms. A lot of the time it's a anal gland that is really full, or it's compacted, and it can't be expressed naturally. So all we have to do is express the anal gland, but it gets commonly mixed up for worms when it's really an anal gland issue. Talking about FELV, I talked about that a little bit on the last slide. So FELV is feline leukemia virus. And again, the prognosis is really poor. Usually once a patient is diagnosed with leukemia, which is blood cancer, it is very fast spreading. It actually goes from the lymph nodes to the blood. So it circulates very quickly, and the patient usually will not survive for, up to a year after being diagnosed. FIP is feline infectious peritonitis. FIV is feline immunodeficiency virus. FIV is feline AIDS. Now, we used to vaccinate for this. We used to have an FIV vaccine, and it actually was FELV combined with FIV. But what was happening was when we were vaccinating for it, patients were starting to come up as false positive. So even though they didn't have it, once we vaccinated, they became positive. So there was like no way to tell whether they were really positive or negative. So they actually took it off the market completely. I know it's back in research and trials right now, so hopefully it'll come back on the market. But just like with people, cats can live with FIV. It's a chronic condition. They can live with it for the rest of their life. We have to, make sure that we're treating them accordingly. Usually we isolate them because if they get sick, they're immunodeficient. So they can't fight off disease like normal, healthy kitty cats would be able to. So we do have to be more careful with them, but it's not like it's a death sentence. And kind of touching back on FELV, we do vaccinate for FELV. So even though it's extremely deadly, the prognosis is very poor, it sounds really scary, we vaccinate cats for it. So there is a vaccine, it's extremely effective if vaccinated. So we strongly recommend, especially if kitty cats go outdoors and they could have contact with cats that are asymptomatic. Guys, what does asymptomatic mean? A cat could have a FELV and they are asymptomatic. What would that mean? Good job. Yeah, Ariana, that is not showing symptoms. Same with Crystal, no sign of symptoms. So asymptomatic means that they carry the disease or the virus, but they're not exhibiting any symptoms. And that happens a lot. They say like 20% of cats that have FELV will live their life and not show any symptoms and they're fine, which means your cat could go outside, be an indoor outdoor kitty, and come into contact with what looks like a healthy kitty. And maybe they get into a little tussle, there's a scratch or a bite, and all of a sudden your cat now has FELV. So it can be really, really devastating. And it's such an easy thing to avoid by just vaccinating your animals. Now, if the kitty cat is indoor and they're not going outside ever, you don't really have to vaccinate for it. They're really at a low risk level. But if the cat goes outside at all, it's recommended to vaccinate for it because, again, the prognosis is so poor. All right, getting into some laboratory terms. So BX is our biopsy. We know C-S or CNS is that culture and sensitivity that will run on the urine. CBC, that's our complete blood count. A chemistry or a chem panel is when we're looking at the different protein and enzyme levels in the blood. So this is when we're specifically looking at, okay, how is the liver functioning? How is the thyroid functioning? We'll run specific chemistry panels to determine that. PCV stands for packed cell volume. So that's how many red blood cells, what's the percentage in the blood. Now the blood usually is about 45% red blood cells and 55% plasma. Cysto, that's referring to a cystocentesis. Again, that's the sterile urine sample that's obtained from the bladder via needle and syringe, directly inserting in. Fecal, that is referring to the stool or like a fecal sample. So again, that's the poop. UA is a urinalysis, which is a urine dipstick test, as well as the specific gravity, which is the concentration of the urine. HW stands for heartworm test. Also, thank you guys for typing in the chat when you're going to go and be on a break. I really appreciate it so that I know that you're not just leaving. Thank you. Again, HW, that's heartworm test, and that's a routine test that we'll do usually at every annual examination, especially if the patient is in an area where heartworm is more prevalent. And then T4, that's when we're looking at thyroid levels. So we're trying to determine if the patient is hyper or hypo. Getting into those pharmacy terms. RX, that's our prescriptions. EOD is every other day or every 48 hours. SID is once a day or every 24 hours. BID is twice a day, every 12 hours. TID, 3 times a day or every 8 hours. And QID is 4 times a day, every 6 hours. PRN means as needed. So let's say the instructions were give 1 tablet PO, SID, PRN. So give 1 tablet by mouth once a daily as needed. So this is most commonly seen when we give pain meds, NSAIDs, or opioids, narcotics to our patients, because there are some days where, you know, let's say the patient has arthritis, maybe one day they're limping, so we're going to give the pain meds, and the next day they feel great, not really needed to give, or maybe a half dose. So we do use PRN, especially when we're talking about pain meds. Q stands for every, so think of like Q8, Q would be every 8 hours, Q8. D stands for day, W is week, H is hour, PO is by mouth, and then the flip term for that is NPO, which means nothing by mouth. And we will use that NPO order when we are fasting our patients for surgery. So when a patient has surgery that day, they are to be NPO that morning. So when a patient is scheduled for surgery, they don't get breakfast that morning. They don't get no water. We pull all of that. They have to be NPO. And that's just because of anesthetic risk. If they eat before surgery, they could possibly vomit while they're under anesthesia, vomit up into their endotracheal tube, into the anesthetic machine. It's a mess. So if a patient eats that morning of surgery, we will cancel the surgery, not a problem, because the risk is so high when they consume food right before anesthetics. More of those pharmacy terms. We've got tab for tablet, cap for capsule, ml is milliliter, and cc is cubic centimeter. Now know, you guys, that ml is equal, sorry, I'm trying to type this in the chat, to cc. So it's the same thing. ml and cc. So you might hear me say, you know, oh, 3 mLs or 3 cc's. It's the same thing. It's just kind of preference. I tend to switch back and forth when I'm talking about that, but they're both liquid measurements. And again, it's the same thing. ml, cc, same measurement, just a different way to say it. Kg is kilogram. So when we're talking about the patient's weight, it can be in pounds or in kilograms. mg is a milligram when we're talking about doses, specifically with like mg per kg or mg per pound, maybe mg per mil. And when you get into module 102, which is your pharmacology module, talking about medications and calculations, we'll go over medical math, and I will teach you all about how to calculate doses. The pound symbol, or LB, is equal to pounds, but we could also use that pound symbol when we're talking about the amount to dispense. And then OZ stands for ounces. Getting into some of our last abbreviations here, you guys, we only have a few more slides to go. So again, with getting into those eyes and ears, so OD is the right eye, OS is the left eye, OU is both eyes. Again, thinking O, round like eyeball, and then drawing the letter in the air to remember which side it's on. And then with our A's, they're A stand ears, like those German Shepherd ears. AD is right ear, AS is left ear, and AU is both ears. All right, talking about some medication administration routes. When you guys get into lab, for those of you that have been in lab already, you know how awesome it is to do these medication administrations, giving injections, or just giving our patients medications. It's a big part of our job. So when you get into lab, you guys will actually be able to do these on, not on live patients, but on our test patients. And when people bring in their animals, you may have the opportunity to give them medications like orally or intranasal. So with our medication administration routes, SQ, also known as sub-Q, means to give a subcutaneous injection, which means under the skin. And most medications, a lot of medications will be subcutaneous. Know that all vaccinations go subcutaneous. We don't give vaccinations in the muscle or in the vein. It goes under the skin for our small animals. When we're talking about livestock like horses or cattle, they actually do get vaccines that are IM or intramuscular, which means in the muscle, but small animals are all subcutaneous unless we're talking about our Bordetella or kennel cough vaccine, which is intranasal, which means to go directly into the nasal cavity. So it's actually like drops that will drop into the nose. And the reason for that is kennel cough, it's a respiratory virus. So we want to treat right where they could possibly come into contact with the virus, which is in their, how they're going to breathe, in their nose, in their, and it also can be administered oral because again, breathing through the mouth. So we know sub-Q, SQ, subcutaneous injections, IM is intramuscular injections, IV is intravenous into a vein, IN is intranasal, and PO is by mouth. Now, some other medication administration routes that are not as common and more of a doctor is going to do this or a technician. So you don't have to worry about it as an assistant, but it's important to know these abbreviations just in case you see them in the future. So IC means intracardiac or directly into the heart. So how we euthanize certain animals, pocket pets, especially like rats or guinea pigs, ferrets, sometimes they will just do an intracardiac injection of the euthanol solution. That's really common. So know that if you work with exotic animals or with pocket pets that you might see that intracardiac, it's really common for the euthanasia. Again, this is when they're sedated. They're not fully feeling this at all at this moment, but it's really common to give it that way because their vessels, their veins are so tiny. IT means to go intratracheal or directly into the trachea or windpipe. Now that's common when we are placing the endotracheal tube. That's the tube that goes down their trachea so that they can breathe while they're in surgery. Endotracheal tube. Sometimes, well, most of the time, Cats are so sensitive and their trachea will close up in a second. They do not like it, even when they are under sedation, to have their trachea touched. So we actually have to take lidocaine, which is a local anesthetic. You may have heard of lidocaine. It's really common in human medicine. We'll actually take that and apply it to the trachea so that they stop trying to close it. It opens up and we can place the tube down their trachea. IP is intraperitoneal or into the peritoneum or the lining of the abdomen. Really only going to see like intraperitoneal if you're doing like a colic or a gastric type of a surgery. We can give antibiotics intraperitoneal directly into the abdomen. IO is intraosseous or into the bone. Not very common to do that unless you're getting like a bone marrow sample testing for like bone cancer. ID is intradermal or within the skin layers. Again, not a super common injection. We really do intradermal when we're doing like allergy testing. We're testing for allergens. If you work with a dermatologist, yes, we have them for veterinaries, for our pets. So you may work with a dermatologist if you ever work in specialty, and that's where you'll see that intradermal injection. All right, some of our veterinary associations, you guys may become a part of those, or your hospitals that you work for might be a part of them. So the AVMA, that's the American Veterinary Medical Association. And when you get certified, you can go and become a member of the AVMA. And they'll send you out newsletters, free CEs, which is continuing education. Highly recommend that once you guys are postgraduate. You may work for a hospital that is AHA accredited. That's the AAHA. We call that AHA. That is the American Animal Hospital Association. Now, they say that the top 20% of hospitals in the United States are a part of AHA. So it's the elite. The very best of the best are AHA accredited. So in order to be AHA accredited, the hospitals have to meet certain expectations with surgical anesthesia and monitoring, their protocols, medication handling. It's a really high standard level of care. So if you work for a hospital that's AHA accredited, they're usually a lot more expensive because their care level is so much higher. And a lot of privately owned clinics will become AHA accredited. Not really, you won't really see the big corporate associations because then all of their hospitals would have to follow under AHA. So it's a lot of the privately owned clinics or specialties that are AHA. NAVTA, this is the National Association of Veterinary Technicians of America. So if you guys decide to continue your education and to go on to veterinary tech school, or in California, you can do an alternate route where you actually, Platt College offers it, where if you work in the field and accumulate, I think it's like 4,000 hours, don't quote me on that. Definitely check out Platt's website if you're interested in it. Whereas if you work in California at a veterinary clinic for, I believe it's 4,000 hours, you can take a accelerated program. It's around 7 months long to then sit and test for your boards to become a veterinary technician. Now, the normal length of a course is 2 years and it's about $50K. To do the alternate route, it's only $7,000. So just work in the field for a few years, take an accelerated program and pay $7,000. That is awesome. And that's a program that's specific for California. And again, guys, that's Platt College. So if you get into the field, you love it, you want to advance your education, please don't go and take out 50 grand to do the schooling right off the bat. Work for a little bit and do the accelerated program. I highly recommend you do that. And then you can become a part of NAVTA. Again, that's only for technicians. OFA is the Orthopedic Foundation of America. So if you work in specialty with orthopedic surgeons, you will see this association. All right, guys. And just some kind of additional notes. I did kind of go over it a little bit in the through the lecture with a few of these. So we know like lateral recumbency, again, that's laying on the side. Osteopathy, bone disease, hematuria, blood in the urine. Arthritis would be inflammation of the joints. Nephritis is inflammation of the kidneys. Remember, nephro is the term for the kidneys. Nephritis, itis is inflammation. Same with arthritis. Arth is the joints. Itis, inflammation. Dysuria, difficult or painful urination. Remember, dys is difficult. Urea is urination. So that's combining those root words with the suffix prefix. Remember what we were doing right at the beginning, you guys? So looking at these words, you guys should now be able to identify what is the root, does it have a prefix, is there a suffix, and what does it mean? Radiograph, we know that that's X-ray, and then hepatomegaly, that's an enlarged liver. All right, you guys, that is all that I have for you guys tonight.